rapid access to comprehensive oncology data and survival analysis. This is the OncoToolkit.
Doctor, do I really need a lung cancer screening scan? Today I saw a patient in clinic. He's 62 years old, still smoking, and wants to know whether lung cancer screening is appropriate, rather than relying solely on age and smoking history. Let's take a closer look. This patient has a 35-pack-year smoking history and continues to smoke about 1 pack per day. He has mild COPD, but no prior history of lung cancer. Given his age and risk factors, the screening decision may seem straightforward, but individual risk can vary considerably from patient to patient. By using the PLCO lung cancer risk calculator in OncoToolkit, we can incorporate multiple patient characteristics to generate a more personalized assessment of lung cancer risk. Let's enter the patient's information into the calculator. Our patient is 62 years old. We'll select high school graduate as his education level. His BMI is 28. He has no history of COPD, so we'll select no. He has no personal history of cancer. There's also no family history of lung cancer. For race, we'll select white. He is currently smoking, so we'll choose current smoker. On average, he smokes 20 cigarettes per day. His smoking duration is 35 years. Because he is still smoking, years since quitting remain 0. Everything looks good. Now let's calculate the score. Here are the results. The PLCOm2012 model estimates this patient's 6-year risk of developing lung cancer. Rather than relying on age and smoking history alone, the PLCOm2012 model incorporates multiple patient-specific factors to provide a more individualized risk assessment. If you'd like to keep a copy of the assessment, you can download the report directly to your own computer for future reference. If we scroll down, you'll find the reference table. It's a useful resource for understanding how the calculated risk may influence clinical decision-making and screening eligibility. You'll also find additional clinical context and supporting evidence used in the development of this model. Thanks for watching. We'll see you in the next OncoToolkit tutorial.